Good morning, doctor.
Good morning!
How are you feeling today? I'm feeling a bit better, but I'm really concerned about my recovery time. I have a lot of pending work at my office, and I need to get back as soon as possible.
I understand your concern. Let's discuss your recovery process and what you can expect in the coming weeks.
Sure, that would be helpful.
First, let's talk about the surgery itself. It was successful, and there were no complications. However, your body needs time to heal properly.
How much time are we talking about?
Typically, for the type of surgery you had, it takes about 6 to 8 weeks for a full recovery. However, this can vary depending on individual factors such as age, overall health, and how well you follow post-operative care instructions.
6 to 8 weeks. That's a long time. Is there any way to speed up the recovery process?
While we can't drastically shorten the natural healing time, there are things you can do to ensure a smoother and potentially quicker recovery. Following our post-operative care plan is crucial.
What does that include?
It includes proper wound care, taking prescribed medications, attending follow-up appointments, and gradually increasing your physical activity as advised. Rest is equally important.
What about work? I really can't afford to be away for that long.
I understand the pressure you might be feeling. Initially, you'll need to focus on rest and recovery. Depending on how well you progress, we might be able to discuss a phased return to work after a few weeks.
What do you mean by a phased return?
A phased return means gradually increasing your work hours and responsibilities over time, rather than returning to full-time work immediately. This approach helps prevent setbacks and ensures you don't overexert yourself.
How soon can I start with this phased return?
This can vary. Typically, we evaluate your condition at follow-up appointments, and if you're healing well, you might start light duties in about 4 weeks.
4 weeks still feels like a long time. Are there any signs I should watch for to know if I'm healing properly?
Yes, there are several signs of proper healing, including reduced pain, absence of swelling, and no signs of infection like redness or discharge from the wound. You should also feel strength gradually returning.
And if I notice any problems?
If you notice any issues like increased pain, swelling, redness, or fever, you should contact us immediately. These could be signs of infection or other complications.
What about physical activity? When can I start moving around more?
Light activities like walking can usually begin a few days after surgery, but you should avoid any strenuous activities or heavy lifting for at least 6 weeks.
Walking sounds manageable. How much walking should I be doing?
Start with short, gentle walks and gradually increase the duration and pace as you feel comfortable. Listen to your body and don't push yourself too hard.
What about diet? Are there any specific dietary recommendations for recovery?
Yes, maintaining a balanced diet rich in protein, vitamins and minerals is important. This helps support tissue repair and overall recovery.
Can you give me some examples of foods I should focus on?
Certainly. Include lean meats, fish, eggs, dairy products, fruits, vegetables, and whole grains in your diet. Stay hydrated by drinking plenty of water.
Is there anything I should avoid?
Avoid smoking and excessive alcohol consumption, as these can impair healing. Also, try to limit processed foods, and those high in sugar and unhealthy fats.
Understood. How about pain management? The pain isn't severe, but it's there.
Pain is a normal part of the healing process. We've prescribed pain medications that should help manage it. Use them as directed, but don't hesitate to let us know if the pain becomes too intense or unmanageable.
Will I need any physical therapy?
Depending on your progress, we might recommend physical therapy to help restore strength and mobility. We'll assess this during your follow-up appointments.
Speaking of follow-ups, how often will I need to come in?
Your first follow-up will be in about a week. After that, we'll schedule them based on your progress, typically every 2 to 3 weeks initially.
I see. What if I need to travel for work? Is that advisable?
Travel, especially long distances, isn't recommended during the early stages of recovery. If it's absolutely necessary, we'll need to discuss it in detail to ensure it's safe for you.
I'll keep that in mind. What can I do to prepare for a successful recovery at home?
Make sure you have a comfortable space to rest, with everything you need within easy reach. Arrange for help with household tasks, and avoid any strenuous activities.
I can do that. What about emotional well-being? This whole process has been quite stressful.
It's important to take care of your mental health as well. Stay connected with family and friends, and consider relaxation techniques like meditation or deep breathing exercises. If you're feeling overwhelmed, speaking with a counselor or therapist can be beneficial.
That's a good advice. Thank you, doctor.
You're welcome. Remember, recovery is a gradual process, and it's important to be patient with yourself. We're here to support you every step of the way.
I appreciate that. I'll do my best to follow all your recommendations.
Excellent. If you have any concerns or questions at any time, don't hesitate to reach out.
I will. Thank you again for all your help.
Take care, and I'll see you at your follow-up appointment next week.
See you then, doctor.